Examination with a brief survey of the patient's thorax and respiration. You have to note the shape of the chest and how it moves, its symmetry, note if there are any bony deformities. Take note of rate, rhythm, depth, and effort of breathing. And check position of the trachea by palpating in the sternal notch. It should be in the midline. Then check the patient's color for circummural and nail bed cyanosis. Let's examine the posterior thorax by first observing the chest for contour, symmetry, and deformity. Also, inspect the skin. Then palpate the chest wall to locate any areas of pain or lesion or bruises. Now, let's check chest expansion. Ask the patient to inhale and exhale deeply and fully. Note, a decreased exhalation may suggest restrictive lung disease.
Okay, just keep on saying
Next,
99.
let's palpate for tactile parameters. Ask the patient to say 99, 99 and keep repeating it. You can feel the vibrations of tactile parameters as the patient keeps saying 99. By using the ball of your hand, identify the areas of increased, decreased, or absent parameters. Continue the examination by percussing the chest in a systematic manner. You have to go in a ladder pattern. Listen to the intensity, pitch, and duration of your percussion notes. Identify the type of notes you're hearing. Normal lungs are resonant. To auscultate the posterior thorax, use the diaphragm of the stethoscope, begin at the apices and proceed downward in a ladder pattern. Listen to the pitch and intensity of the inspiratory and expiratory sounds and decide what type of breath sound you are hearing, and also listen to any added sounds. Okay, I want you to say E. Now let's test for egophony, that is E to A changes which occur in lobar consolidation for pneumonia. Tell the patient to say E and keep repeating it. Normally you will hear a muffled E sound. Say 1, 2, 3. Next, check for whispered pectoral equi. Ask the patient to whisper 1, 2, 3 and repeat it. The whispered voice is heard faintly or indistinctly, if at all. Clear, louder sounds suggest underlying consolidation. Start by examining the condition of the skin and inspect the chest for deformities, asymmetry, etc. Next, palpate the chest to locate areas of tenderness or to access any lesions, etc. Access chest expansion by observing how far your thumbs diverge as the thorax expands and feel for the extent and symmetry of respiratory movement. Next, palpate for tactile parameters. Compare both sides of the chest using the ball or ulnar surface of your hand. Parameters is usually decreased or absent over the precordium. Next, triggers the anterior chest and lateral chest. The heart usually produces an area of dullness to the left of the sternum. To auscultate the chest anteriorly and laterally, ask the patient to breathe with his mouth open, a little more deeply than normal. Listen to the breath sound, note their intensity, and identify any variation from normal vesicular breathing. Please say 99. Identify any adventitious sounds, and to listen for transmitted voice sounds, tell the patient to say 99 and repeat it.